So the question is, what is a TENS unit and how does it differ from vibration stimulation? So a TENS unit is transcutaneous electrical nerve stimulator. There are other acronyms like neuromuscular stimulator, NMES, but the basic idea of all of these is that you're using electrical stimulation to trigger the motor nerves to block the pain nerves. So pain is a very small, tiny sensation, but it is meant to be heard very loud in the brain because it's the alarm system. So this is carried on a nerve called A delta nerves, and they're a web that is all over, just a cloud of little teeny tiny A delta nerves going to your spine to transmit brain to your head. And around them are much bigger nerves that are telling your body where you are in space. These are called the mechanoreceptors. So you have really light ones called Messner corpuscles that are on the top, and those are the ones that feel menthol or your icy hot or the creams. They also feel very low frequency, tingly electronic stimuli. So when you have a TENS unit, you're going to have a positive end and a negative end. Sometimes there's stickers that go on, but it's transmitting electricity in a certain frequency to stimulate those little bitty nerves on top. That stimulation is more important to the brain than pain is. So instead of feeling pain from your wrist injury, you'll feel the little tingly sensations and you won't notice the pain as much. It's kind of like when you're trying to drown something out obnoxious from the room next door, you turn up your music so that you don't hear it as much. So the electrical stimulation is turning up the sound of other sensations. So there's another kind of mechanoreceptor that's called Ruffini, and it does stretching. So this is why yoga helps. But the most powerful of all of these is called the Pacinian corpuscle, and that's really deep, and it is mostly around joints. So it's much more important to your body that you can escape from whatever is causing the pain, and you can't do that unless you know where you're putting your feet and how you're pulling your arm back from a burn. So TENS units also have types that will stimulate a pretty high frequency, about 60 to 120 hertz, and that is with a much stronger electrical current to try to penetrate down to get to those deep Pacinian corpuscles, so then it'll short circuit the pain. So what vibration does is basically the same kind of thing. The deepest nerve, the Pacinian one, that is really sensitive to very high frequency. And it's also sensitive to a pretty consistent light amplitude. You don't want to be like a jackhammer or a theragun or something, because that's going to end up damaging the nerves. What you want is a very high frequency stimulus, and when you have that, it's going to selectively address those corpuscles that are going to block off pain. The thing about vibration is that instead of having to either twitch the muscle to twitch the nerve or use enough electricity to penetrate down to the nerves are designed to feel motion. So using a mechanical oscillatory spinning motion is exactly what these nerves are designed to feel. So you can stimulate from a knee or an elbow. You can put the vibration on, it's really a knee one, but you put the vibration on directly where the pain is, and so you're drowning out the sound of the pain by having such an intense stimulus of this A beta Pacinian corpuscle. Some people call them A beta nerves, they call them large afferents. Doesn't really matter, we're all talking about the same thing. The other part about the TENS unit versus vibration is that it helps to have as many different sensations going as possible. So you can add to the right frequency of vibration, you can add cold, you can add heat, you can add other sensations that also help drown out the pain. Finally, it's much easier to decrease pain if you know you can put something on quickly. So one thing about TENS units is you will need to replace the stickers, you will need to kind of spend some time to get it in the right position. But since the body's designed to feel motion, it's a lot easier to feel less pain using motion. One other thing that these deep pressure and position sense nerves can do, this means that you could push massage, you can use specific points, you can rub, you can use stones. The research for vibration is much more detailed, but the concept is really the same for a lot of different kinds of stretching, movement. What we're trying to do is just use the body's own resources to decrease pain instead of letting the little A delta fibers win. So that is the difference between a transcutaneous electrical nerve stimulator and a mechanical external nerve stimulator and a pressure or a light sensation pain reducer. Thank you very much.